right, good morning and welcome to the Wilson Center. We're going to get started. I know some people are still dealing with traffic, but we will get started. So I'm Sarah Barnes and I lead the Maternal Health Initiative. And for those of you who are not familiar with the Wilson Center, it's a living memorial to President Woodrow Wilson, who remains the only president to have earned a PhD. The center is a nonpartisan and non-advocacy policy forum focused on independent research, open dialogue, and actionable ideas. The Maternal Health Initiative is one of the center's thematic programs that works across regions to explore a wide range of policy-related topics focused on the health of women, adolescents, and children. Today, we are thrilled to partner with both UNFPA and Guttmacher Institute to bring you a discussion on making it a priority, adolescents' health and rights. Thank you to UNFPA and Guttmacher for making this event possible, and a special shout out to Jesse Boyer and Mandira Paul for all their organizing. I'd also like to give a warm welcome to all of our incredible speakers here today, and we thank them for their time and energy and the enormous amount of expertise that they bring to the table. Today we will discuss a variety of topics related to adolescence, including comprehensive sexuality education, both in schools and out, access and quality of sexual reproductive health services for adolescents, and how issues like early marriage and early childbearing and lack of schooling options can impact the health and well-being of young people. Adolescence is a time to support young people's access to information, to education, to skills, and to services that can result in a healthy and safe transition into adulthood. It's time to make adolescence a priority. For today's discussion, we'll have an open dialogue between our moderator and our panelists, as well as with the audience. We also encourage those who are watching online to please send questions to @Wilson_MHI, and the hashtags are also on the screen behind me. Before turning the event over to our moderator, I'd also like to thank Amanda King, Isabel Griffith, and Lizzie Wang from MHI for all their hard work putting together this event. Now I will turn things over to our panelists, starting with our moderator, Preston Mitchum. Preston is a senior legal and international policy analyst with Advocates for Youth and a Youth Health and Rights Coalition co-chair. Preston's and all of the speakers' bios are printed and available at the end of the tables. So thank you again for coming to the Wilson Center, and a warm welcome to all of our speakers. Preston.
Good morning, everybody. Good morning. So I have my coffee, so I'm pretty good right now. I hope you all are enjoying the coffee and pastries outside. So welcome to Making It a Priority, Adolescents' Health and Rights. Thank you to MHI, Guttmacher, and UNFPA for even making today's event possible. As Sarah noted, I'm Preston Mitchum, the Senior Legal and International Policy Analyst with Advocates for Youth. Advocates for Youth envisions a society where, sexuality is viewed as normal, healthy, and treats young people as assets rather than subjects. We do this by championing policies and programs related to young people's sexual and reproductive health and rights, but especially for young people all over the world, but especially marginalized young people, including LGBTQ young people, gender nonconforming young people, gender non-binary young people living with HIV, young people with disabilities, among others. One such example of how we do this work is through our AMAZE initiative or project, which you can find at www.amaze.org pitch. So AMAZE is a consortium with Advocates for Youth, Answer, and Youth Tech Health, really teaching very young adolescents between 10 to 14 years old about sexuality education through short animated films. AMAZE covers topics ranging from puberty to healthy relationships, to reproduction and pregnancy, to personal safety, and to sexual orientation and gender identity. AMAZE does challenge harmful and social gender norms and is groundbreaking for many young people in the parts of the world. So while there's no doubt incredible efforts underway to center comprehensive sexual and reproductive health and rights, including comprehensive sexuality education, it also doesn't escape me that today we will discuss this comprehensive nature of SRHR among adolescents when just this past weekend, the White House would attempt to have us believe that some people's entire identities don't exist. And so the goal of today is to center all adolescents, especially those who are often pushed outside of the margins. And as moderator, I want to use my personal privilege to not only honor and center trans people in this space, but outside of this room and online who may be watching. You are here and you belong. As many of us know, adolescents face unique challenges and significant vulnerabilities due to marginalization, across the globe. Early marriage, a lack of accurate and complete sexual and reproductive health information, lack of quality health services can make these challenges more monumental. So the risk of maternal mortality is highest among adolescent girls, and what's more, sexual and gender-based violence, including discrimination based on sexual orientation and gender identity and expression, and a greater susceptibility to STIs such as HIV, further marginalize young people. Yet, adolescence should be a time to support young people access to information, education, and skill set. So CSE and increased access and quality of health services are but a few of necessary efforts to promote adolescents' health and well-being. That's why I'm honored to be moderating today's discussion with such amazing people who are working on CSE and research, policy, programming, implementation, among others. And so with each panelist's work and experience, I know today will definitely be an exciting conversation. And so just to level set with you all, since we're in such an intimate space, I want you to know how we're kind of going to go through this morning's conversation. So as moderator, I'll introduce each panelist one by one and allow them to describe their own work. And again, please note that you do have the fuller bios because we'll be here all day describing their wonderful work. And then I'll ask them one specific question, time permitting, before moving on to the next panelist. And afterward, we'll have a group conversation. And if anyone knows anything about me, which you will today, it is that I love interactive conversations. And so the goal of today should not be, it's not I am a professor, but it's not to listen, right? It's not for this Q&A type format, though we will have time for that. The goal is to also use your experiences to shape today's conversation. And so if there's anything that triggers you in a wonderful way, you can snap, you can applaud. I did grow up in church, unfortunately, sometimes. And so because I take real big call and response, right? That is just really big for me and hopefully for the room. And so if there's anything that's really great for you, please make that known, ask your questions, and let's have an interactive conversation. Is that good? Yeah. All right, perfect, because y'all do not want to hear my voice all day. So or maybe you do, but because of that, I'm gonna start and turn to the first panelist for today, who's Lada Nuzhna, the youth representative for Teenergizer. And Lada, you can start with just describing your work, and then we can get into the questions afterward.
Okay, so my name is Lada. I was born in Ukraine, and I've been advocating last years for sexuality education in Ukraine, and specifically for rights of HIV-positive youth, just because Ukraine has the biggest epidemic of HIV, with Russia, and we are trying to ensure that young people in the post-Soviet area, they get good services. And it's hard just because post-Soviet area is really biased environment. So we can go to the question.
Absolutely. Thank you for that. So for you, why is CSE important from a youth perspective? I'm glad you're here. A lot of times we do have adults, and I'm critiquing myself with this conversation, working for Advocates for Youth. Sometimes as adults, we ask adults why youth are important. So I'll ask a youth representative why youth are important. So from a youth perspective, why is CSE important, and why should it be important to everyone?
Okay, so I feel that topic today is really special. I want to force that we are not talking about just sexuality education, because personally, there is a huge gap between sexuality education and comprehensive sexuality education. This might not seem obvious just because for most people, it's just over-creation of advocacy documents to make it look nice. They see where is that. So it's not obvious, and I want to explain it. Because when talking about youth, health, and rights, what do we mean by youth? Why do we always see youth as this group of white, straight girls and boys who have never moved out of their own country and have never had risky behavior? Moreover, why do we think they have never had experience in sexual assault? Or why do we think they don't have limited abilities? Our society doesn't look like that. Also, when talking about HIV in a class, why do we think that we don't have HIV-positive people there? I want to give you an example of such story because I was doing a lot of peer-to-peer education back in Ukraine. And one time, one school invited me to give a peer training, and I had great time doing that just because teacher and class, they seem to know everything about HIV. They were answering questions, and also they were really open-minded about like such topics as discrimination of HIV positive people. But after the training ended, the teacher said one small phrase, which multiplied by 0 all the training. It was, okay, now you know everything about HIV, and I wish you to never meet an HIV positive person in your life. The scene became worse when we realized that they actually had an HIV positive girl in that class. What I'm trying to say is that even if we have great sexuality education, it doesn't mean it's adapted to needs of everyone in a group. Also, if we have a great sexuality education, it doesn't mean we have teachers who are ready to teach such topics. Bad services are the one which are not inclusive, and we cannot, society cannot adapt to bad services and become more healthier and more well-educated, but good news, we can adapt those services to the needs of society, and that is what comprehensive sexuality education is about. It doesn't seem like a strange thing to put ramps for people with disabilities, right? So why is it so obvious to make education and sexuality education for everyone? And long story short, the world now is approaching a completely different philosophy, and in countries where inclusion in education and services is a value, we can implement their CC more easily. So how can we do that? How can we do good comprehensive sexuality education? Like, that's a lot. I have a small case which can answer that question. A year and a half ago in Ukraine, Ministry of Education were launching a new school program, and they were launching a new school program for the basics of health classes. So my organization, Teenergizer, we are working with HIV positive teenagers, and we decided to set an open discussion about sexuality education and basics of health. It was somewhat scandal, which is a mundane thing if you are speaking about sexuality in a post-Soviet area. But in the final, we achieved what we wanted, because Ministry of Education invited us to give our amendments to new Basics of Health program. For the first time in history of my country, and I think in the history of post-Soviet area, HIV positive teenagers were telling what they want in the Basics of Health program about HIV and AIDS. Wouldn't it be great if young people with disabilities tell us what needs do they have in education, or if we knew the needs of LGBTQ plus youth firsthand? And that is my answer about how can we implement it. Nothing about us, for us, without us. Thank you.
Yes, Lada, thank you so much for that. That's incredible. A couple things I definitely took away from that is really, why do we center who we center? Who are the young people that get to center and share their experiences, if any at all, and really listening to and centering the needs of young people. And so I really appreciate that. To Lada's left, we have Kate Ling. Kate is a senior technical advisor of AYSRH for Pathfinder. Kate, if you can tell us a little bit about your work, and then we'll definitely lead to a question as well.
Sure. My career has been fully focused on adolescence since I was in my 20s. So it's been a long trajectory, and I have to say it's been exciting to see the evolution of adolescent programming, and the fact that we are sort of at this sort of tipping point, if you will, about the importance of adolescence to achieving global development goals. I'm currently working for Pathfinder International. Pathfinder has a very long history of working in adolescents, over 40 years of programming for adolescent sexual and reproductive health. And I think Pathfinder, probably along with Advocates for Youth, were two of the organizations that really early on recognized the importance of adolescent sexual and reproductive health to overall youth development, but also just to achieving better well-being in general. We have adolescent programming in 15 out of the 18 countries where we work. We see adolescent sexual and reproductive health and rights as a fundamental human right. We increasingly implement our programs through a positive youth development lens. I've spent 6.5 years at USAID, where I helped to develop the youth policy and then the Youth Power Project, and so very excited about the whole movement towards positive youth development, seeing young people as assets, seeing the importance of building protective factors, which comprehensive sexuality education is certainly one of those important protective factors. We really aim to normalize adolescent sexuality and development and recognize that young people really need comprehensive information, they need autonomy of choice, and they need age, developmentally, culturally relevant programs that are responsive to the sexual and gender diversity of young people. And so some of the populations that we spend a lot of time focusing on, we do a lot of work with married adolescents, we do some work with very young adolescents, marginalized groups, and we're starting to think more about how we can do work with disabled youth, LGBTQ populations, beginning to really segment and diversify the kind of programming that we do. Very quickly, we are committed to certain principles. One is youth participation and engagement. This is also an area where we're really starting to put more thought into how do we walk the talk of youth engagement within our own organization. We believe in working with health systems to become more adolescent responsive. So we have to go beyond just projects and youth-friendly clinics to make sure, and adolescent corners and so on, to make sure that health systems are more responsive to the particular needs of young people, and not just in sexual and reproductive health, but in health in general. We try to implement effective social and behavior change programmings, recognizing that adolescence is a really important time if exploration and when positive and negative behaviors are established. And so those behaviors that are established in adolescence affect them across the life course. So it is really important for us to be ensuring that young people lay down a solid foundation of positive behaviors which will carry them forward into adulthood and beyond. We want to ensure that there's a supportive social, cultural, and political environment. So we really try to work within a socio-ecological framework of the individual, the family, the community, and the political environment. And again, just reinforcing this notion of there's no one-size-fits-all. We have to be diverse and segmented and responsive to the needs of the young people that we're trying to reach.
Absolutely. Thank you for that, Kate. And so you noted that we have to go beyond the project, and I definitely agree. But Pathfinder has been really working on a great project, ironically enough, called the Great Project. Can you talk about that a little bit? And then the initial question I would posit from that is, when should CSC start?
Well, I think UNESCO can talk. Oh, you're from UNFPA. But UNESCO, the International Technical Guidelines from UNESCO, I think, start sexuality education at the age of 5. But I would say it goes much earlier than that. And those of us who have had young children, mine are now, they're young adults, but kids start asking questions pretty early, and so and kids start exploring their bodies pretty early, and so that I think it's really important for all of us as future parents or current parents or people who work with young people to recognize that sexuality it occurs across the entire life course, and we need to be ready and prepared to answer questions when children ask them, and not sort of don't talk about that. That's not appropriate, and hush them up and sort of. I don't want to say demonize, but, well, yeah, in some respects, demonize sexuality and lay down all kinds of sort of negative thoughts around it. So if we're trying to be positive about sexuality and adolescent development, it needs to start as soon as kids start asking questions. We have done a lot of work with the Gender Roles, Equality, and Transformation Project in collaboration with Georgetown University's Institute for Reproductive Health in Uganda and in other countries as well. And basically this works with kids between the ages of 10 and 14. In Uganda, we worked in schools, but it was more of an after-school program because it's been very challenging to get comprehensive sexuality education embedded in schools, even though we know the evidence, we know it's effective, we know all these great things, but there's so many challenges to embedding it in school systems. And in some respects, when we do get sexuality education into schools, it's in the secondary schools, and significant numbers of kids drop out from primary school, don't go on to secondary school, or even once they're in secondary school that they tend to drop out. And so the kids that start in secondary school may not be the ones that finish. So the Great Project really did a lot of work with games, participatory approaches, lots of fun, interactive activities where young people could learn about puberty, could learn about contraception, could learn about gender. And one of the things, one of the most positive things about this was that I think we really found in that project that this is such an important time to talk to young people about gender roles and gender identities, because this is when young people are beginning to acknowledge, question, and identify who they are. And so once young people reach around the age of 16 or 17, unfortunately, it seems like a lot of those gender roles and gender biases become somewhat entrenched and much more difficult to change. So at that period of 10, 11, 12, when young people are going through all of these physical, psychological, cognitive changes and kind of questioning their communities and questioning the norms and the beliefs, this is an outstanding time to allow them in a sort of a safe, supportive environment to explore those norms and to develop more positive attitudes towards gender as well as sexuality and reproductive health.
Definitely. In looking at that, right, in individualized ways beyond this idea that young people have to exist within a binary. I mean, I know, like, even with Advocates for Youth, we're working on a Maze Junior project, which really focuses on even younger than very young adolescents. And the thing, to your point, that we really hear a lot of information about is that the information is still very gendered.
Yeah.
And though obviously we know that there is a point where that needs to be the case, we can discuss power dynamics, healthy relationships, etc. But there still has to be a point where we're really discussing beyond that, really discussing the lifespan. And the hashtag we consistently have used is more info, less weird. And so to that point, in talking to young people about sexuality education and comprehensive sexual health, it's important to destigmatize sex and sexuality in a way that makes it more normal and healthy for people's daily lives. So thank you for that.
Can I add one
Oh,
additional
please,
thing?
please.
Yeah, so we actually are implementing a project with the Gates Foundation in Ethiopia called Act With Her. And so some of you may know about the GAGE project out of ODI in the UK. And when they went out to sort of begin to kind of cull the field for information, they realized that there wasn't necessarily enough information. So they're supporting this kind of, it's a somewhat complex project with multiple arms. But we're starting with 10 to 14-year-olds girls. And one of the things, Gates came back and they said to us, you know, we want you to do some work around LGBTQ. Well, you go to Ethiopia and they're like, no, we're not going to talk about contraception. No, we're not going to talk about LGBTQ. So we've been kind of exploring how we can address the issue of LGBTQ, given Gates' interest in this. And one of the things we've landed on is perhaps approaching this through bullying. So this is when a lot of bullying starts. And so can we start to work with young people to help them understand that differences, you know, as they begin to see differences among their peers, and that's when some of the bullying starts, because they bully kids that are boys that are effeminate or girls that are too masculine, or, you know, people that fall outside the sort of the norm of what's acceptable behavior. And so kind of taking that somewhat more roundabout approach to getting to helping young people understand and accept different lifestyles, different choices, different behaviors.
Thank you. Next up, to Kate's left, we'll have Dr. Ilya Zhukov. Did I help at all? Okay. The global focal point for CSC for UNFPA.
Thank you, Princeton. This morning I was thinking, so how should I provide you information about my work? And I was thinking, so why, when I decided to work in the field of HIV and comprehensive sexuality education, and you know, my imagination, my memory took me back in 80s, in the time of AIDS crisis. At that time, of course, I've been even much more younger than Lada now, and of course, AIDS crisis didn't affect me directly. But at the same time, I think it gave some kind of trajectory for my future professional life. So it was, I think, 1988 or 1989. It was perestroika in the Soviet Union, because I'm Russian. It was a bit of freedom, but still it was very conservative and oppressive environment around. And we didn't have, like Lada has now in Ukraine, peer education or any trainings for young people. So every week in our high school, we had some kind of, we called it political information, where each of us every week could provide some information about politics or economy in country or outside, and to share it with peers. So usually it was very boring, non-interesting, so everybody hated it. I loved it because I'll explain you why. Because I always trying to find something interesting to share with my peers. And I think it was 1988, so I found the article in one of British magazine or newspaper, I don't remember which one, about Princess Diana when shaking hand of a guy living with HIV. And I shared this article, this political information. So my teacher, she was frozen. She didn't know what to say, how to react, because it was so unusual that time to speak openly about HIV and about everything around HIV. And my peers, they were shocked too, so they just opened their mouths and they couldn't say anything. So, of course, at that time, I didn't understand that all of these AIDS crisis, it will some kind of, generation-defining bottle for many of us. But I think it became the first time when I became interested in this topic, then take into account my sexuality, living in a conservative country, in an oppressive environment. So all of this together maybe put me in the medical school. And when I finished my PhD, I moved to the NGO, working with communities, first of all, with women who inject drugs and who living with HIV. And with all of this background, then I joined UNFPA in Russia. So now I'm based in New York in headquarters, and part of my job, I cover sexual reproductive health and rights of young people from key populations. So it's adolescents and young people who use drugs, young people, young men having sex with men, young trans diverse people, and I forgot to mention, and young people selling sex. But the main focus of my job now is comprehensive sexuality education. Again, now many people, when I tell them, oh, I'm working in sexuality education, they told me, oh, it's so hard. Yeah, within last years, we repeat like a mantra. So we have such a conservative backlash, it's such hard times, it's so hard to work in SRHI and sexuality education. Right, but at the same time, I think we are in a very good momentum in terms of comprehensive sexuality education. As Kate just mentioned, so this year, not UNESCO led that process. I'm proud that this new guidance, you can find it outside of our room, it was endorsed by 6 UN agencies. So it's our joint United Nations position about sexuality education. And here, in this new guidance, we have evidence. So now, after 10 years from the first guidance was published, we have enough evidence that sexuality education works. So now it's not some kind of pilot or fantasy, it's something that we could implement with our partners. And another guidance is coming now, is guidance on out-of-school CSE. Secondly, the good moment, look at LADA. So, in times of this conservative backlash, activism is much more visible and much more valuable. So I'm so happy that we, in many countries and at regional level and global level, we have a lot of activists, including from key populations and young people who help us to develop guidance, to implement it, and who lead advocacy of sexuality education. And just maybe to end this intervention about my work, I would like to give you a quote from my boss, executive director of UNFPA. She said that earlier this year, the high-level event about on sexuality education in New York, she said that young people have a right to information that is not only life-saving, but going to add to their ability to have a healthy, pleasurable sexuality. So this is the part of our job in UNFPA as well.
Yes, I love that. Thank you, Ilya. And so I know you spoke to the guidance, which has been wonderful, and we definitely support. And I do believe that facts will matter again one day. And so that's sadly sarcasm, sadly true also. But to that end, since you are the focal point for CSC, and I'm going to keep track of time with this question, why is it hard for people to talk about sex and sexuality?
Yeah, you can ask me why it was so hard for me to speak about sex and sexuality even 10 years ago, despite I've been working most of my life. I've been working in the field of HIV with key populations. I conducted trainings with specific populations. And it was okay for me to talk maybe to other people, but for years it was so hard for me to speak about my sexuality. And now when I'm thinking about that, I think one of the main reasons is just because of the lack of knowledge. So the problem is that many people, or even most of the people, they do not understand the meaning, and they do not understand what does it mean, this terminology, sex or sexuality. I do agree that it's very hard and it's not easy to define sexuality because this is a complex. So actually the bottom line that sexuality is about to be a human being. It's about humanity because it includes our attitudes and to our body. It includes our relationships. It includes love. It includes gender identity. It includes sexuality orientation. So all of these dimensions, they are affected by many, many factors like political, social, psychological, etc., etc. So sexuality, it's a very, very complex definition. So that's why we need to explain it to people and we need to educate people. So that's why, as already Kate said, I think sexuality education, it's some kind of the entry point to educate young people, to provide them with knowledge, first of all, but sexuality education is not only about knowledge, it's about skills and attitudes. So if we provide this opportunity for adolescents and young people, I think that when they become older or in their life, so they will be more open to this discussion about sex and sexuality. I think my life could be different if I could have access to sexuality education when I've been a teenager.
Definitely. Definitely. And as all three of you have already indicated, right, it's that knowledge that really helps to destigmatize sex and sexuality and really gives the ability for young people to ask questions that they want to ask that they may act upon anyway, but may not do it in a healthy way because they're not provided the information because we don't empower them to actually receive that knowledge. Thank you so much, Ilya. To Ilya's left is Sarah Keogh, who's a senior research scientist with the Guttmacher Institute. Sarah, if you can please describe your work, and then I'll ask a question.
Yes. I've been with the Guttmacher Institute for about 6 years now, and I've had the opportunity to work on lots of different sexual and reproductive health issues, but definitely one of my favorite ones to work on is adolescent sexual and reproductive health and rights. And Guttmacher's been doing quite a lot of research on adolescence in recent years. We've looked at 10 to 14-year-olds, we've looked at the costs of meeting contraceptive needs, we've looked at abortion in Africa, and of course CSE, which I've been mostly involved with. And the idea behind our recent study on CSE was that we know that a lot of low and middle income countries have CSE policies and curricula in place, but we don't really know how they're implemented in schools, like what is actually going on in the classrooms. And so to find this out, we conducted a study in 4 different countries, in Ghana, Kenya, Peru, and Guatemala, where we interviewed secondary school principals, teachers, and students about it. And some of our findings were quite surprising, I think, and I'll just highlight a few here. For example, in Kenya, we found that only 2% of students had learned about all the topics that constitute CSE. 2% is really, really low. And in other countries, it was 7 to 9%, so still really not that great. We found that the teaching was very focused on biology, with not much on values, gender, rights, not much on contraception either. It was very factual information, like these are the ways that HIV is transmitted, and not much skills-based learning. For example, how to negotiate condom use with a partner. We found that many teachers were teaching actually inaccurate information. So for example, in Guatemala, we found that 40% of teachers were teaching that condoms are not effective for preventing STIs, which is a bit worrying. And then in Africa, we found that some teachers were teaching kind of moralistic fear-based messages. For example, they taught that, for example, in Ghana, I think 8 in 10 teachers taught that having sex is immoral or dangerous for young people. So yeah, those are just a few of the highlights.
Oh, well, that's okay. Don't even know the word to use there. It's you're right. I mean, it's sad to really hear it here. I mean, we clearly know that those things exist, right? But to really hear it is both somber, but I'm also empowered with what you're going to share with what to do with the results next.
Right, yeah, so we're hoping to do a lot with the results. We've actually done already quite a bit. So we've published a report on each country that's available on our website. And we've also got some 2-page fact sheets that summarize the findings. And I think those are available outside. And we really want the findings to get into the hands of those who can actually use them in the 4 countries. And so far, it's actually been pretty successful. Our findings have already been used by the ministries of education in Ghana and Kenya to try and strengthen their curriculum, which is really fantastic. Peru and Guatemala haven't done anything so far as exciting with the findings, but maybe soon they will. And we're continuing to analyze our data. We've just published 2 papers on the barriers to implementing CSE, which could be quite useful. And those papers are available for free as well. And recently, we've been trying to build an index that could be used by governments to try and measure how well they're implementing their program. And because these findings have been so far pretty useful to the advocates in the 4 countries, we're hoping to replicate the research in other countries. And so we're looking for funding for that at the moment.
Perfect, thank you. And then we can come back and hear some great news, right? That's the goal. Okay. All right, and so lastly on the panel to Sarah's left is going to be Senator Nikolaj Edwards, who's an independent senator with Trinidad and Tobago.
So, hi everyone. It is indeed a pleasure to be here this morning and to contribute to this very important discussion. Now, back in Trinidad and Tobago, the work that I would do in relation to sexual and reproductive health care is mainly at the level of the UNFP Youth Advisory Group. I'm the co-chair of that group, as well as I am an advisory committee member for the Committee under Family Planning Association of Trinidad and Tobago, which actually looks at a pilot study that we're conducting in 10 private schools into the rollout of a comprehensive sexuality education curriculum. And we are using the It's All-in-One curriculum. And the reason for that is the government has not actively taken a stance or a position when it comes to the rollout of health and family life education with the component of comprehensive sexuality education. So we have it in place where it is policy that it is supposed to be taught in the schools, but when you go into the schools, it's a different situation. So what they're actually doing with the Ministry of Education is utilizing teachers who are already in the system, who are teaching other subject matter, and asking them to volunteer their time to roll out comprehensive sexuality education. But the right training is not in place. So you have teachers who are uncomfortable, who go into that with their own misconceptions about sex and sexuality. And so when they are put in a space to teach comprehensive sexuality education, it's very uncomfortable for them. And a lot of them would pull away from a scenario like that. So we are seeing those gaps and those issues. And I believe that the work that I do is more or less providing a platform or a space for young people to let their voices be heard when it comes to the issue of adolescent and youth sexual reproductive health care. Because what we find is in Trinidad and Tobago and in many other parts of the world, there is that perception that the country is conservative, and as such there would be certain issues that persons in high public office would stay away from. But for me, I often question, is it that we are a conservative society, or is it that it remains a figment of our imagination that we are a conservative society? Because as you look around and as you explore the landscape, you're seeing more and more young people being vocal on issues, more and more young people engaging in risky behavior, as well as more and more older persons supporting young people when it comes to their rights and also their roles and function in society. And I think it's about leveraging those opportunities. When I was called upon to serve in the Senate in Trinidad and Tobago, the first piece of legislation that I was able to debate on had to do with the Marriages Acts. And what it looked at specifically was child marriages. Because before last year, in Trinidad and Tobago, it was completely legal for a child to be married to, as I say back home, a big hardback man or woman. And what it really means is an adult. And for me, having been able to contribute to that as my maiden contribution in the Senate, it was really a powerful moment in our history, because you had a young person sitting in the Senate being able to contribute to this historical amendment to our legislation. And I often say more and more young people need to be allowed into spaces. It's one thing to give them a seat at the table, but it's far more important for them to have that seat be used effectively, because tokenism is real. Quite often we're seeing where persons are saying, well, at least we had a young person in the room. At least a young person signed on to this. But when we look at the contribution or the space or the time allotted for that young person to speak, it was very minimal. And we need to change that kind of dynamic. And I believe that now, more than any time before, we have young people who are educated on the issues, young people who can hold their own, young people who can contribute in a meaningful way. And when it comes to comprehensive sexuality education, especially, and the rights of young people in this fora, we need to ensure that we ask them the questions and not make we not perceive what the answer would be. Because I always say we should never assume, we should infer. Assuming means that you're just looking at something, not delving into it and making a conclusion based on that. But when you infer, you're actually using facts, you're actually using information to help you come to a conclusion. So I've been able to utilize the space back home to start that conversation, because as we look around in Trinidad and Tobago, you're seeing young people in spaces having the conversation, but it's not taking place on a national level. And far too often I find that we are preaching to the converted. So we're going into spaces where persons already know about adolescent and youth sexual and reproductive health, but how are we going out and championing the cause among those persons, those young people especially, who absolutely know nothing about the issue? I think those are the spaces where we need to really ramp up and put our energies. And I'm glad that I've been able to found the Trinidad and Tobago Youth Convention, and at our past convention in September, we were able to have on the discussion, on the agenda, sex and relationships. And you would be surprised at how many young persons actually flocked to that workshop, and they left more empowered, understanding that the terms, understanding the repercussions of some of their actions, but more so understanding that sex is not something that we should be afraid of. It's not something that we should run away from, but it's something that we need to understand much better so that we can be operating in a healthy environment. So that has largely been some of the spaces that have been agitating back home. And of course, there would be backlashes to these things, but I mean, once you're in politics, these things are expected. What I've found specifically is that the more I become known in the public space, or the higher I climb, so to say, I've realized that a lot of groups have been coming to me and bringing concerns and issues. So for instance, comprehensive sexuality education was not something, let's say 5 years or so ago, that I would have been actively involved in, but I've learned and I've taken the time to sit down and have conversations, ask the relevant questions, and then be able to champion the causes. And it's all about allyship. I'm not here to come and sit down and take over the space whatsoever, because that can be very counterproductive. But I'm here to be an ally to the cause, because I do see it as something very important if we are to be progressive societies.
So snaps and applause and everything all around. Senator Edwards, something that you really talked about was really young people being the experts of their own experience, and kind of with the mirrored conversation with Sarah in a way, as far as the difficulty of actually implementing CSE, even if it's written in policy, right? It's the actual implementation that becomes the harder part. And then your last part about potentially facing backlash or actively facing backlash. And so I guess my question would be to the latter part. How do you then still talk about CSE, and why is it that important to talk about CSE in Trinidad and Tobago if you know that you'll still experience some potential backlash?
I've had experiences in a very public way that it started off as persons having very strong opinions against what I was saying, but it was a situation where had I just simply accepted that there are persons who are against the things that I was saying and feed it off, I would not have had the opportunity to continue to agitate and convert persons, because it's all about providing the information in a way that people can relate to, because there will never be everyone agreeing to the things that you see, but you have to find common ground somewhere, somehow. And it's when you look into those spaces and you realize that these are the things that we have in common, you would see that the backlash is diminishing over time, because persons are recognizing that this actually makes sense, and then you become credible in their minds. So you have to have tough skin to get into this kind of work, whether you are at the level of an intern working at the UNFPA or a UN agency, or you are the director of a particular program. You have to have tough skin, and tough skin does not come just like that. You have to be willing to take risks. You have to be willing to put yourself in uncomfortable scenarios, and it's then that you truly blossom and realize your potential as an individual. But if we starve ourselves of these opportunities, we will never be able to grow. We will never be able to understand the power and potential of ourselves as individuals. And so me coming into this sphere where uncomfortable discussions had to be had, it really was a challenging experience, but something that I would, if I had the opportunity to do it all over again, I would do it, and do it just the same way. And we need to have that kind of a mindset. But for young people, I think we've had a history where we've told young people, and this is more or less a saying back home, where children are to be seen and not heard. So we instill in their minds that they are supposed to go with the status quo. They are supposed to listen to their elders and not object or not challenge whatsoever. And the more and more we're seeing young people challenging, and it's not out of being disrespectful, it's not out of them wanting to challenge because they're just simply rebellious, but rather because they know better. They are the experts when it comes to their own experiences, and we need to open up more spaces. Social media has been a very important part or player in terms of young people getting their voices out there, but it has also taken a toll, or in some cases for some persons watered down our advocacy efforts, because persons think that all you do is just sit down behind a computer and speak and voice your opinions. But when you do that, there may be someone on that social media platform who has learned something, who is able to take away. So we should not criticize our efforts at advocating, but understand that there is a time and a place for each platform that is provided, and we need to exploit it as best as possible.
Yes, thank you. I mean, online advocacy has really been the biggest source of change for the past couple of years, and I do think we have to honor that, and really using the tools that are available and who can use them best other than adolescents. So thank you for that. And so just to keep us all on task, just to let you all know, we're going to open this up to a couple of group questions. And then in the meantime, definitely think about the questions you would like to ask the panelists. And if you're online, definitely do the same. Get your questions ready. Use the hashtags, tweet your life away. Even if you're not an adolescent, everyone will see it and it'll be great. So thank you all so much for that. And so I'll really get into the conversation of youth engagement, because I really don't want us to lose sight of not tokenizing young people, but really involving young people in the entire process from beginning to end. And so how can we ensure that young people are meaningfully engaged in the process of formulating the programs, implementing the programs, specifically related to their own health? And this can be for anyone on the panel.
Okay, actually, I had a lot of experience like giving speeches, and it was like nothing compared to what I had while doing this international technical guidance of comprehensive sexuality education for out of school. Because a month ago, I had an interview with Andrea, who is currently writing this guidance, and she is working in UNFPA, right? So she was asking different groups of people, LGBTQ+, HIV positive one, young people who sell sex, young people injecting drugs. And she was asking really specific good questions so young people can answer and can relate them. And I think that was the best way to ensure that our opinion was heard, just because when you're giving a speech, you are rather like a Hollywood star, and everyone is like watching you and saying, "Whoa, that is so sweet. She's so young, and she's saying something." But when your opinion and your thoughts, they are influencing like real documents that then will influence your education, that is a real thing.
Absolutely.
So funny you should ask, Preston. We just had a really good meeting yesterday, sort of with a group of us at Pathfinder to talk about this issue of meaningful youth engagement at the upcoming ICFP, FP 2020, and a group of young people have come up with a statement on meaningful youth engagement, which they will be launching at the Youth Lounge, which Pathfinder is sponsoring at ICFP. And so it feels like it's really opportune for us as an organization, given our long history in working in adolescent programming, to really start to be more intentional about how we engage youth. And sort of our conversation was a bit free-flowing and free-ranging, but we talked about the fact that we probably haven't done a very good job as an organization. And oftentimes it's because sort of youth engagement activities are linked to projects. And so, we'll engage youth in the design of a project, and then the funding ends, and we're like, thanks very much for your input. And I've seen this happen over the years, where we engage young people, we solicit their input, we ask them to tell us what they need and that they want, and we rev them up, and they're excited, and then we're like, thanks so much for your input. Now we're going to go implement our project, And so there isn't this kind of conduit or this system of ensuring that we bring youth into the conversation on a regular basis. In part, it's challenging because young adolescence and youth is a dynamic period of life. If we engage young people, we can't necessarily expect that they're going to be with us for the next 5 years, because they're in school, they're working, they're getting married, what have you. It's a dynamic period of life, and we can't necessarily expect a 5-year commitment, but maybe a 2-year commitment is reasonable. So we have to, I think, put aside resources, whether it's financial, whether it's human, whatever, to really pay attention to good youth engagement. Like I said, we were talking a little bit about, trying to create youth advisory boards or councils or groups, maybe not youth advisory groups, but because that sounds sort of passive and, sort of asking them to rubber stamp what we're doing. But these kind of fellowships or councils or something where we consult with them periodically and just make sure that we're kind of on the right track and that we're sort of responding to the needs of young people. And also seeing this not as a one-way street of us soliciting information from them, but as an opportunity for them to develop skills, to develop networks, to develop, to gain access to things that they wouldn't normally gain access to. Mm-hmm. 2 things I think are really important around youth engagement. One is I think we have to do training of adults that run organizations to be receptive to the voice of young people. I think there's oftentimes this kind of like, thanks so much for your input. A little patronizing, and a lot of times as adults are kind of like, well, I don't know what to do with this. And then the other thing is I think we also have to help young people find a voice that is sort of, that adults can also respond to. There has to be this kind of sense of partnership that we kind of have to meet each other in the middle. And I think we've seen a lot of young people that are passionate, that they're activists, they want change and they want it now, which in some respects older adults might find a little sort of threatening. So how do we also help young people to develop sort of more of an advocate's way of speaking, taking some of that activism and passion and channeling it into some of this more discourse that may be a little bit more comfortable for adults who are still going to be in charge of resources and programming decisions. So I think it's something that we have to tackle. Mm-hmm. I think it's been, I think we saw this in 1994 at ICPD. There was a huge cadre of young people that attended the conference. We have not done a very good job of it. So I kind of throw it out to all of you as a challenge to be continuing to think about how we really can meaningfully and not just meaningfully, but engage with young people as partners in what we're doing.
Absolutely.
Hard to add something else, what been already mentioned by Lada, by Kate, and Senator already started to speak about youth engagement and participation. Just maybe one thing. When we are talking about youth participation, we should think about the diversity of young people. So young people, it's not just one homogeneous group. So there are a lot of populations and subpopulations. And in the HIV world, when we develop HIV prevention or HIV treatment programs, more or less, UN and partners follow this rule about engagement of young people from key populations. If we are talking about many other programs in the field of sexual reproductive health and rights, I think it's still a huge problem. Even inside UN, sometimes I hear from my colleagues, oh, we can bring young people who use drugs, so young people selling sex, and to put them on the one table with people from the governments. No, this is not possible. Yeah, this is possible. So because we have to remember about the diversity and not only key populations, indigenous young people in developed countries, they are totally left behind, but we have to include them in our 2030 agenda, and we should remember about them. Because unfortunately governments from developed country can easily give funds and support young people in other regions of the world, but often they forget about these populations in their own countries. Disabled young people with disabilities, whom we already mentioned. In terms of sexuality education, we should remember that young people with disabilities, they have a right for pleasurable sexuality as any other young person. So we should bring them on the table and involve them not only in discussion, but in the development and implementation of our programs. So, yeah.
Thank you. And I believe that Sarah or Senator Edwards, did you have a follow-up?
You go ahead. Yeah.
Okay, so I just wanted to touch on an experience that I had back in 2009 when Trinidad and Tobago hosted the Commonwealth Heads of Government meeting. I was fortunate enough to be a part of the youth forum there. And I remember coming out of that experience very excited, supercharged to go out there and be involved in youth work and youth development and looking for the next opportunity. And I remember coming out of there and looking around, and there were no opportunities for young people in a substantive way. And that was more or less a spirit crusher. Because there you are, your expectations have been heightened. You have been encouraged to go out and do all of this great work. But where are the institutions? Where are the support mechanisms? Where are the opportunities? And far too often, I see young people get exposed to opportunities and be told that they can do anything that they put their minds to. But when they actually attempt to go out there and do things, you look at the environment and it's not conducive to youth development in a substantive way. And I think that is one of the major issues that young people face, because we are always told that you should be doing this and you should be doing better and X, Y, and Z, but where are the support mechanisms? So I know for a fact that under the Commonwealth, there is the Youth Mainstreaming Guide, which is one document that can be used to help with mainstreaming youth into the various arms of the state. So be it at the level of the government, whether it be at the level of lower level institutions. But the fact is that we need to mainstream young people into the decision-making process, where it's not a matter of let's bring a young person into the room as an afterthought, but it should be highlighted or written there that a young person has to be a part of this discussion or has to be contributing in a significant way. I also see national youth councils as playing a very important role, because you have a lot of countries who do not have the mechanism in place for a national youth council, and they tend to suffer, the young people that is. So by having institutions, and I know St. Lucia, coming from the Caribbean, I can speak to St. Lucia as having a national youth council incorporated through an act of parliament. So a government can come, a government can go, but the National Youth Council remains and has an active role in contributing to discussions and issues surrounding young people. Also, with respect to funding, as was highlighted, we do need to have funding mechanisms. But for far too long, when it comes to young people, the main funding streams that they get would be for things such as sports, arts and culture. And when we want to get into opportunities where young persons can go to forums around the world, or leadership or capacity building exercises, you tend to be told by corporate entities and even the state that, well, this does not fall within the criteria of our normal sponsorship or our normal funding. And that is a spirit crusher as well, because you know that you're going out there to do good work. You know that you're leaving your country to be exposed to other opportunities or learning opportunities, to come back and spread that knowledge and that information. But because it's not one of those things that are attractive as sports or arts and culture, you're not going to get the funding. So we need to, on a national level, on a global level, revise the kinds of activities that we fund, because, as was mentioned as well, it seems as though we're willing to fund events, but we need to fund institutions that are set up to empower young people. We need to fund programs that have a long-term effect. And yes, young persons are afflicted by that level of expectancy that many older generations may not understand, but it's because we're in a digitally connected world where we're seeing things happening in other spaces, and then you question yourself, why isn't this happening here? Because you know it is possible. You know, with someone just having the political will, it can happen. So that's why you're seeing young people going into spaces and agitating and ramping up, because it's not that they have an unreal expectation. It's just simply that the expectation is not being met with the resources that can be dispatched in a reasonable timeline.
Absolutely. And doing it in ways that actually connect young people beyond the publishable report.
Yes.
Right. And so, again, we rarely have the support mechanisms, as you all noted, and there's rarely any leadership pipelines that have really been developed in ways that are non-tokenizing for young people. And so I do know that we had Lana with the follow-up, and then Kate.
Yeah, I just wanted to give a short comment from my experience, just because in our advocacy environment, we always expect young people to be advocates. But what if, like, HIV positive person don't want to disclose his or her status? So they won't have an opportunity to speak, right? And like that experience we had in my organization, Teenergizer, because we have more than 1,000 HIV positive people in the capital. And when they were coming to us, we were asking them to be advocates, to give speeches, but this also means for them that they need to disclose their status or to disclose their LGBTQ preferences, and we can't do that. I mean, we need to create a safe environment and safe spaces for young people to speak without being advocates.
Yeah, I just wanted to sort of add to what you're saying too, that, you know, I didn't want to sort of leave the impression that, you know, young people have to become a certain way to be heard. And I also think we have to be careful to not sort of only tap sort of the elitist youth, right? I mean, so, and I think this is a really good point that you made, was that, you know, why can't we have a young woman who sells sex on the stage, or a young person who's an injecting drug user? And there is this sort of tendency to, and I've seen this in conferences where, like, a young person will stand up, they're very articulate, they're very poised, all the adults in the room want to work with that young person, then that person becomes sort of the professional voice of 1.8 billion young people. And I think we have to sort of be careful and check ourselves so that we're not always just singling out young people that we as adults are comfortable with. And we have to find space to bring in other young people whose voices may not be as smooth, may not be as articulate as somebody who's had multiple opportunities to go to multiple conferences around the world. I wanted to give an example of some work that I did in a project. I worked in Jamaica for about 5 years, and we wanted to do some peer education programs. And so the first round of training we did these wonderful camps. And the first round of camps we went out to the schools in a particular parish of Jamaica and asked them to send us, you know, a group of young people that would participate in this camp. And the first round of kids they sent were like, yeah, we're not really feeling this. And so we went back to the schools and we're like, you know, so who did you actually send? And of course they sent the kids, the young people that the teachers had nominated, that the principal, the headmaster thought were good. They were all like the class prefects, you know, and we'd be like, so what do you do as a prefect? Well, I maintain order and discipline. Well, what do you do as a peer educator? Well, I maintain order and discipline. And we're like, oh, no, this is not the youth leaders that young people are looking up to. These are the kids that are like, you know, running to the principal and telling on their peers. So we went back to them. We said, okay, send us the kids that are out in the field smoking cigarettes. Send us the kids, or weed in the case of Jamaica. Send us the kids that are like the troublemakers. They're leaders in their own way, but they're not necessarily the good kids. And they very reluctantly sent us this group of young people that were kind of the troublemakers. And that, honest to God, if we could have done an evaluation of that, I think we would have seen some really promising findings, because a lot of these young people said, nobody ever paid any attention to me before. Nobody recognized that I had these leadership capabilities. And these young people, in fact, became the most powerful peer educators, peer advocates, because we saw something in them. We saw leadership, even though they'd been told that they were bad, that they were useless, they were problematic. We said, no, we see something in you. We see you have the capability to take those skills that you have as, sort of maybe persuading your peers to get into trouble, to persuade your peers to get into some healthier behaviors as well. And we had a number of them that came back over a period of time that said, thank you so much. I've turned my life around. It was this life-changing experience. And so we knew we'd done something right. But again, it was sort of like we went beyond sort of the first tier of young people that all the adults said, these are the ones you want to invest in. These are the youth leaders. And we said, no. We're going beyond that. And I think it was one of the best things we did as a project.
Yeah, and I think that's honestly something worthy of applause, because quite frankly, what oftentimes happens, right, we don't have this idea. In the organizing community, something that we describe is really building from the ground up. And so it's how do you actually impact the most people on the ground? You really start to think about who's actually had the most hard impacted life, and how can you actually build out people from that actual experience to then obviously train up other communities too. So it's a very fine, good trainer of trainers approach. And something that you said, Kate, really resonated with me, because it made me think about this past International AIDS Conference at a plenary session with Dr. David Malbranch, when he said people need to stop calling communities hard to reach simply because they don't reach them.
Yes.
And I think that was just such a critical moment, because we hear it all the time when it comes to, most at-risk or key populations. We're like, oh, where are these people? And it's like, oh, the people that you just ignore, they're there. You just haven't reached them because that's not your focal point. And so kind of leading from that, before we open it up to the audience, what I'm thinking about is out-of-school CSE. In specific subgroups of young people who often don't receive a lot of attention. I'm thinking of young people with disabilities, young people of sexual and gender diversities, and trans diverse people, and young people in detention. And so I know, Ilya, this is something that you've worked on a lot, but if anyone has any just expertise or just thoughts, how do we actually, what specific needs are do those specific subgroups of young people need for out-of-school CSC?
Mm-hmm. Yeah, good question. So, last year we spent about 6 or 7 months with our partners to conduct literature review, to analyze, to find evidence how to deliver out-of-school comprehensive sexuality education to specific groups of young people. So in our new out-of-school CSC guidance, we are focused on several specific groups. First of all, it's young people from key populations, LGBTQ young people, intersex young people in detention, young people with disabilities, indigenous young people, and also we're trying to analyze existing programs of delivery CSC separately for girls and for boys. So the main outcome of the literature review about out-of-school CSC, unfortunately, we don't have enough evidence about out-of-school comprehensive sexuality education. Just to maybe to underline one thing, we are talking about the evidence on the ways of delivery out-of-school comprehensive sexuality education. We have enough evidence now about comprehensive sexuality education in general and about in school that it works. We have enough evidence about the content, but unfortunately, when we were trying to analyze programs, existing programs within the last 10 years in different countries and in different regions, it was so hard to find pure comprehensive sexuality education. So usually it was it was focused on one of the components of sexuality education. Most of the time it was HIV prevention education, or maybe it was focused on relationships, or maybe in any other aspects, but we couldn't find the pure comprehensive sexuality education delivered out of school. Even in successful programs, the problem was it was not well documented. So we have a lack of peer review articles about out-of-school comprehensive sexuality education. So this is another gap of the evidence of out-of-school CSE. So what we see ahead of us within the next 3 or 5 years. So we are going to start to implement in several countries out-of-school comprehensive sexuality education. We hope that Norway will support us in this. And then we will try to evaluate and to provide the well-documented case studies and examples of out-of-school comprehensive sexuality education. And to make it clear once again, so in terms of the content, more or less it's the same. It's the same about in-school and out-of-school CSE. So comprehensive sexuality education mostly focus on 8 main concepts. So just briefly maybe to remind you about them. So first one, this is about understanding gender. Second one, it's about human body and development. Third one, it's violence and staying safe, including GBV, including cyberbullying, etc., bullying, etc., etc. So then it's sexual reproductive health and rights. Then it's about sexuality and sexual behavior. And just to be on the safe side, not to forget everything, it's about relationships, it's about families, it's about love, it's about friendship, and 8K concept, it's about skills for health and well-being. It's about negotiations, it's about refusals, it's about all of this comprehensive field about health and well-being. So the content is the same. Talking about out of school, we are talking about ways to deliver out-of-school sexuality education. And secondly, some of the groups, specific groups, they need specific content. Like, let's look at the young people in detention. When they release from detention or from jail, so they need some support and some knowledge and some skills how to reestablish their relationship with their family members, how to start new relationship, like how to say on the first date to your date that you've been in jail or you've been in detention. It's a huge problem. So young people and adolescents, they don't know how to do this. So if we go through each of the 8 concepts, so we will find something specific for young people and adolescents in detention. Young people with disabilities, go to the website of WHO, open the classification. I'm a medical doctor, but I never worked with young people with disabilities. When I started to work on out-of-school CSE, and when I finally carefully looked through this classification, I thought, oh my God, it's such a diverse group of young people with disability, sensory disability, psychological disability, a lot of others. So, and each of these subgroups of young people with disabilities, they need specific ways how to deliver sexuality education, and they need some specific topics how to address their needs. So I'll share with you one secret. So we expected to finalize our guidance for out-of-school CSE in May this year. And I should say we're still in the middle because we didn't expect how hard and how huge amount of work is ahead of us. So hopefully we will finish it early next year, and we will launch this out-of-school CSE guidance with our UN partners, and then we will start to implement it in several selected countries.
Thank you for that. And so I just think it's obviously really important to have that conversation. And then to also, before we get to, that's the last before we get to, you were here, I promise. Sarah, I would love if you also could just talk very briefly as connected to the out of school, really discuss the barriers to in-school.
In-school.
Yes, to in-school CSE.
Yeah, so in the research that we did, we found quite a few barriers to implementing CSE in school, and they were actually very similar across the 4 countries that we went to. And so I'll just mention a few. In terms of the curriculum, in addition to it being not very comprehensive, as I mentioned before, we often found that countries had a kind of one-size-fits-all curriculum for the whole country, which is good in some ways, but it can also, it doesn't always take into account the different needs of diverse populations in the country. For example, indigenous youth in Guatemala and Peru, their needs were not really taken into account. Also different language needs across the country. The fact that CSE was integrated into different subjects, I don't know what it's like in Trinidad, but CSE is integrated rather than a standalone subject. And again, this model has a lot of advantages, but it can also dilute CSE because there's no dedicated time for it in the schedule. And teachers can easily kind of skip over topics that they don't want to teach, for example. And when we asked teachers themselves what they thought the main barriers were to their teaching CSE, inadequate teacher training was one of the really big ones in all countries. I think between 60 and 90% of teachers said that they needed more training. And a lot of teachers didn't actually have any training at all, and they were teaching CSE. Another big barrier was lack of teaching materials. I think less than half of teachers in most countries had access to a teaching manual for CSE, for example. And then monitoring evaluation was also pretty weak. Usually, or in some cases, CSE isn't completely examinable, and so there's not much monitoring of students' learning outcomes in school. And then there were some more kind of structural barriers. We found that CSE implementation was often hindered by poor program coordination in the government. And this was often due to the lack of a dedicated CSE team in government. Often it seems like CSE is, a responsibility for CSE is shared between different teams in different ministries with obviously different priorities. And I think that having a dedicated team championing CSE that would span the different levels and the different sectors of government would really help to kind of to coordinate the activities and to prioritize CSE in budgets as well. And this brings me to the other really big barrier, which was, of course, funding issues. Really big barrier in all 4 countries. There's never enough money for CSE. And partly because there's no often there's no dedicated team or dedicated program, the funding for CSE tends to be very piecemeal and from lots of different sources, often from international agencies. And this can create sustainability issues when the international agencies withdraw from the country without adequate local capacity building or alternative funding to fill that gap. So yeah, those were some of the barriers that we found.
Thank you. Thank you.
If I can.
Very briefly.
Very briefly. So I don't like the word barrier when we speak about it, because actually what you just said, it's not barriers, it's gaps, so which could be covered. So the very good point about teachers. So teachers should be trained and teachers should be supported through their work all the time. And here we are talking about comprehensive sexuality education as curriculum-based. So the curriculum should be written and it should contain learning objectives, teaching objectives, it should contain the key messages, it should contain presentation of topics and concept and objectives. So in this case, teachers will never be afraid to deliver sexuality education. And then teachers, they not necessarily should be experts in sexuality. So in our trainings, which we deliver to teachers, we train them to deliver participatory approach, so for their active listening to adolescents and young people. So these teachers should understand the needs of young people and to address their needs in terms of sexuality education. And the last point about parents, it's also one of the misconceptions. People say, oh, parents is a huge barrier to deliver sexuality education. No, not at all. We have evidence, we have programs that when we educate parents are the great supporter of sexuality education, and even we found some peer-review articles which shows us that parents could be even more effective in their in delivering sexuality education, in their conversation with their children about contraception or condom use, etc., even more effective than peers. But again, we should work with parents and we should educate parents to make them our supporters.
Absolutely. Thank you, Ilya. And thank you, Sarah. Thank you for talking about, yes, the structural barriers and then the gaps in implementation as well, because we do have to make sure we have a good time for audience interaction. I want to hear more snaps, though, and questions. Can we be promised that over the next 20 to 30 minutes interaction? Y'all have questions? All right. Okay. Maybe. Okay, so if you have any questions, just make sure to raise your hand, dance around. I'll definitely make sure to call on you. Only thing I would ask is that your question ends in a question, or at least, you know, elevate your voice to at least pretend there's a question mark at the end of that sentence. That would be great. All right, and so we're gonna start with about 2 to 3 as well, just to give people a chance to kind of adjust and answer. Any in the room right now? Sure.
Thanks for this. I'm Lara from Pathfinder. I want to know if any of you have some great experiences, examples of working with religious communities and youth, and how does that work? What are some good examples of that?
Do we have any more in the room? And then one more, and then we'll go to one of the Twitter questions.
Hi, thanks so much for this. My name is Marie, and I am a researcher with PAI. I'm wondering if you can talk a little bit more about the pleasure component of CSE when it comes to adolescence, especially given that it's still a bit taboo talking about pleasure and sexuality when it comes to adults. What's the guidance on that at the UNFPA level, and what that experience has been like in implementation of CSE, especially with relation to religious and morality within countries?
Thank you for that. 2 very good questions in the room. And so I'll round that off with a question from Zoe Bowles with, how do we involve key youth populations when networks and capacity does not already exist? Pardon me. So the 3 questions, 1, again, is the experiences working with religious communities and young people. 2 is separate but still connected to religious communities and kind of a moral framework. So a pleasure component of CSE, in adolescence, any guidance at UNFPA and just generally with implementation. And then the 3rd one is, how do we involve key youth populations when networks and capacity don't really exist? And please, by all means, don't feel empowered to answer all of them, but do, as a community, feel empowered to at least answer the 3 questions.
So maybe, I can start from my experience about religious communities, not from my global experience. Actually, we have these colleagues who are working with religious communities at UNFPA global level and very successfully. But from my experience working in the country, when I've been 8 years with UNFPA country office in Russia, and from 2009, I think, till 2013, we were trying to implement in selected regions sexuality education. Again, we didn't call it sexuality education, and actually that is now the position of UN. We don't push countries to call it sexuality education. So we call it the whole concept, comprehensive sexuality education, to understand what's included there, but we are fine if countries will call it one way or another. So in Russia, we called it HIV prevention and SRHI education. It's been already 10 years ago, and it's been hard that time to, to find the entry point to come into schools, even with HIV and SRHI education. We decided to work with Russian Orthodox Church. You know that Russian Orthodox Church is very conservative, but at the same time, that years they had the program, some kind of, they supported this kind of education for adolescent and young people, and it allows us to come into schools. But at the same time, of course, Russian Orthodox Church, they were totally against to bring into the classes any discussions and any mention of condoms or contraception or any sexual behavior. So it was a hard choice for us, and finally we found the compromise. So we implemented this sexuality education in regions where we had strong, established, youth-friendly clinics. And the teachers and schools, so they provide the referrals, so there was a direct link to youth-friendly services. So all adolescents and young people who needed this kind of information, skills, or knowledge, they were referred to these clinics, and there they got this education, contraception, condoms, etc., etc. So this is some kind way of of partnership with faith-based organizations in implementation of comprehensive sexuality education. So going back to the international technical guidance, UN technical guidance, one of the main difference of this guidance to compare with 2009 guidance, that this new revised guidance states positive sexuality. So we promote this positive sexuality. Of course, it depends on the age of the young person. So Kate already said that this guidance recommends to start sexuality education from the age of 5, but it doesn't mean that we recommend to deliver it the same way at the age of 5 and at the age, let's say, 15. So we divide young people into 4 main age groups, so 5, 8, 9, 12, 12, 15, 15, 18 plus. And sexuality education is going through, it's like incremental process. So every year it's based on the previous learning experience. And depending, sexuality education is age appropriate. So depending on the age of the young person, we discuss with them different topics, including pleasurable sexuality. At the same time, again, I do understand that in many countries, in many realities, any discussion of sexuality, and especially positive sexuality, could be a problem in schools. So that's why, again, we need sexuality education in schools to be complemented by out-of-school sexuality education, because out of school we have more flexibility to cover more topics, to use different approaches, to have more fun discussing these topics, which sometimes is not appropriate in schools. So yeah, it's again about the importance of out of school to discuss sex, sexuality, and pleasurable sexuality. Absolutely.
Yeah, and I think one of the spaces where this kind of pleasure conversation is happening is in the digital space. And so I was in India about 6 months ago and was looking at a number of organizations. India is become quite conservative around talking to unmarried adolescents about sexuality and reproductive health. If a young woman comes to a clinic and she's unmarried, they're required to report her and her partner because of, you'll remember that really horrible rape that occurred a number of years ago. And so young people have actually, where the government has not been reluctant to respond, a lot of young people in the savvy digital space folks have begun to develop websites and various sort of social media campaigns that are responding to the information needs of young people. And there's oftentimes this disconnect between what we as public health professionals think is important for young people to know. So we come in with the contraceptive messaging and the use a condom every time, and young people are like, I want to know about relationships, I want to know about sex. And so this is where some of the digital websites and various other things are talking about pleasure, are talking about how to have the best orgasm of your life, you know, and it's really interesting because it's very complementary to some of what the public health messaging says, but also framed in the context of what young people themselves are really curious about and really trying to understand about themselves, in addition to, oh, why would I use a condom? Why would I use contraception? So just, I think we have to find that balance between what young people really want to know and what we as public health professionals think it's important for young people to know.
I can
Please, Sarah.
speak a bit about the in-school situation. About the religious communities, I think everyone agrees that it's really important to involve religious communities to get their buy-in. If not, CSE is just not going to be taken up in the country. So it's definitely really important, and all the 4 countries that we went into agreed with that. But I think it's sometimes difficult to strike a balance between involving them and them ending up dominating the process. And in the 4 countries in which we did our research, this happened a lot, that religious communities ended up dictating what was in the curriculum, particularly in Africa and in Ghana and Kenya, because there wasn't that much dialogue between other civil society organizations, youth organizations, and the religious organizations. And so they were just kind of dominating the debate, basically. In Latin America, the situation was a little bit different. The religious groups were also very they also dominated the debate, but there was much more of a dialogue. And because of that, there have been lots of kind of different protests from religious groups and civil society organizations, youth organizations in Peru and Guatemala recently about CSE. So it's a bit more of a productive debate, I think, but it's a really interesting question, and I think it's hard to strike that balance. And then just briefly about the pleasure component, I think this is really interesting as well. And we wanted to ask more about what was going on in school. What are they learning about pleasure? And I can say that they're not learning much, and that in Ghana and Kenya, we weren't even allowed to ask it in the questionnaire. They were like, we had a few kind of components that mentioned kind of pleasure and other positive words, and they were like, no, you can't ask that. So we don't even know.
With respect to involving key youth populations where networks and capacity do not exist, I am currently the motivational speaker and facilitator for a Canadian-based organization called We Schools. And what that has allowed me to do is to enter into spaces, into schools, to speak to students about achieving their fullest potential, helping them to develop campaigns around advocacy efforts and so on. And what I've found is that once I've entered those spaces and spoken at length on the particular topic that I've been asked to speak on, I would start to build a community of young persons who are interested in more information even beyond what I have presented to them. And so they will come and follow me on social media or come onto my pages, and therein I have an opportunity to start to sensitize them to other issues. So it comes like a marketing ploy, so to say. You go into the space, you advertise one thing, and then you have the consumer coming because they're interested in your product. But while you have them there, you start to expose them to other opportunities and other important information. And I think that is one way of covertly going into those spaces, and you are hinting or whetting the appetite of the young persons to other issues, because where we have that disconnect, we need to figure out how do we fill those gaps, how do we bridge these issues. And truth be told, when we think about comprehensive sexuality education, this is linked to so many other issues in society. When you think about health and family life education, so we can't isolate these topics. We have to find creative ways of getting the conversation going. And it leads me back to when we were speaking earlier about how do we engage the out-of-school populations. We have in Trinidad and Tobago, the UNFPA liaison office in Trinidad and Tobago was able to develop Youth Connect, which is an app that provides the kinds of information that young people need when it comes to where you can find a clinic, you can speak to someone live on that app, you can engage in games as well that exposes you to the pertinent information. And of course, every young person has a smartphone. Well, for the most part in developing countries at least, have these smartphones smartphones, and this is one way of ensuring that they get information. We need to also have an enabling environment. So when a young person do decide to go into a health clinic, we need to ensure that this will not be their first and last experience. So how we treat with that individual, the signage that is up, the spaces, if we're respecting them and their confidentiality, those would be the gateways for us to engage them further into other issues. And television programs, you can't go wrong, because I know many of us in this room can probably recall we would have looked at, be it Fresh Prince of Bel-Air or Seventh Heaven or Family Matters. And while you would have looked at that for entertainment purposes, you would have gotten some sort of a messaging in there. So if it was an episode that dealt with suicide, for instance, at the end of that episode, you would see if you or someone you know is dealing with suicide, call the suicide hotline and so on and so forth. And we need to be using those opportunities. I'm seeing on Netflix lately that there are two programs, well, one program on Netflix, Big Mouth, that deals with puberty, and it's very, very in your face, and the language may not be appropriate for everyone, but it gets the conversation going. And I'm seeing even blurbs of that being on social media and so on. And when you look at Insecure as well, you're seeing topics being addressed in a way that you can relate to. So we need to be leveraging these opportunities to start to get messaging in a subtle way as well as a very explicit way, because this is how our generation is interacting now. On some quarters, you have persons who are not ready to get a whole lot of information coming to them at one time, information overload. But then there are those who are ready for it. Oh, that's easy pickings. Yes, I've heard of that before, and so on. So we need to start looking at what we have available to us. It's not about reinventing the wheel whatsoever. And one of the things that I always say is that we in this kind of work, it should never be about getting it perfect, but about getting it better. Because if we constantly look toward what the perfect scenario would be, and every time we fall short of that, we will not forgive ourselves. But if we look and see that we are better off here based on the work that we've put in, it gives you that energy, that effort to go on, to continue. So we need to start looking at things in realistic pockets. It's not about, yes, we have the end goal up on the wall, posted, plastered there, but at the same time, how do we just ensure that tomorrow is better than today? And I think once we set our expectations in a realistic sense, I'm not saying that the end goal is unrealistic, but start to look at milestones. And every time you go along, check off one, and you will find sooner than later you are at that finish line.
Yes, thank you for that. So shout out to Insecure and Big Mouth. Those are actually really incredible. Insecure usually comes on Sunday nights at 10:30 p.m. on HBO. Just the plug that I get no compensation for. So thank you for all of that. And also another plug is Amaze really have been looking at pleasure and masturbation a lot more. So we do have videos for very young adolescents on masturbation. So although I will say comment sections are usually where dreams go to die, for these Amaze videos on masturbation, we have found very fascinating questions from young people. So I will encourage you and even more assertively implore you all to look at these comment sections so you can really see what young people are interested in, because even in my youthful lookingness, I did not have those same questions when I was that age. And so I am just like so inspired by the fascination that young people have and know is their bodies and how to explore their own bodies. And so I think that's incredible. We're going to do another round of questions. We can start. Are there any more questions?
Conversation going. My name is Caitlin. I'm in the Office of Population and Reproductive Health at USAID. So a big elephant in the room, and I think we've talked about it a little bit, is that it's implementation that is the problem when it comes to CSC. We know there is evidence for it. We know that it works. I mean, I want to question it works for what, but we know the implementation is the problem. And I appreciate this comment that we just had about realistic milestones. Mm-hmm. So I wonder, in your opinion, what are some of those levers that we should pull maybe low-hanging fruit that could improve the implementation of CSE, especially given the evidence that Guttmacher has pulled together. We know that the situation out there is pretty lackluster. So what were some of the recommendations in that report? What are some of the most effective ways that we can get to a little bit better, if not ideal?
Thank you so much. Any more questions in the room?
Hi, my name is Elena from Guttmacher Institute. Thank you to the panel. I'm very interested in how you incorporate and promote within CSE self-acceptance and a desire to have a good life because you're worth it. By the time many young people access information about CSE, they've already had a number of social influences, media influences, peer influences that have set their relationship with themselves. And so I'm interested in how you foster autonomy and the right to self-determination when you have a population that is quite often maligned, regardless of what they look like, purely for being an adolescent, and then layering on top of that all the other things that they're up against depending on their circumstances.
Absolutely. All right, and we do have one online. So the three questions are: what are some of the low-hanging fruits, so to speak, that we can use to improve CSE, and specifically looking at Guttmacher's recommendations? How do we incorporate self-acceptance, the desire to have a good life simply because we know we're worth it, without, I guess, especially understanding that, there's a lot of alignment with what's really happening in a larger societal space? And then how can organizations ensure the safety and potentially being anonymous if needed and requested of key youth populations who provide their perspectives? And so we talked about the last one a little bit, but just kind of expanding on how can organizations ensure safety for young people who provide their perspectives, particularly if they're more marginalized or more vulnerable. All easy questions, I'm sure.
I can start with maybe some recommendations on implementation. I don't know if there are really any low-hanging fruits. If there were, maybe we would be already picking them. But I mean, obviously, teacher training is a major one. I think even kind of before that, to start with, yes, we have all this great evidence that's out there on successful programs, but not all countries have curricula in line with that evidence. And so I think one of the first things is to help governments develop curricula that are in line with the latest evidence, to have, technical advisors that, within the country or external or a bit of both, to help them develop these kind of really comprehensive curricula. We need to make sure that they promote practical skills, because if not, adolescents are not going to be able to implement all this great information that they're learning. We need to eliminate the fear-based messages that are often coming through, because evidence shows that they don't discourage adolescents from having sex. So let's just help them have protect themselves and have healthy relationships. We need to make sure that they focus more on gender and rights and even contraception, which sounds simple, but there's just not that much in the curricula at the moment. And I have to say that Latin American countries seem to be doing a little bit better in their curricula. They're a little bit more gender focused and rights based. So I think other countries can maybe learn from those Latin American countries as well. As a few people said here, we need to make sure that CSE is implemented from primary. And especially in low-income countries, most kids go to primary, but not that many have the privilege of going to secondary school. So we really need to make sure that we're reaching those adolescents as much as possible. So definitely teacher training is really one of the major things that we need to invest in. We need to make sure that it's obviously comprehensive, but also standardized across the country, which is not the case at the moment, that it's sustained over time, that it's not just kind of dependent on one international organization coming in and doing some training and then going out again. We want to make sure that it's ideally a compulsory and evaluated part of general teacher training, both pre-service, so before teachers start teaching, and also in service as a kind of professional development, ongoing professional development. And we want to make sure that it's for all subject teachers, because CSE does tend to be integrated in different subjects. So basically, all teachers need to be trained in this. And the last thing that I would say, which is maybe a low-hanging fruit, I don't know, is to strengthen the referral links between schools and youth-friendly sexual and reproductive health services, so that young people can have the support they need outside of the school setting.
Okay.
I was just gonna add one point. I think this has been a conversation I think that this field has been having for many, many, many years about how we know that comprehensive sexuality education, there's a lot of good evidence behind it, and yet it's been incredibly challenging to get into schools. Other ways that I think this can be done might be through partnerships with NGOs that can come in and do this kind of education, because we know it's quite uncomfortable for many teachers to teach in the classroom. So are there ways that we can partner with non-governmental organizations that can come in and teach some of this content, so that the teacher doesn't feel like they have to teach a subject that they're uncomfortable with? But I think we have to keep exploring different ways of doing this, above and beyond sort of layering it onto teachers, because I think teachers are also struggling with just getting kids through school to pass all these comprehensive exams that they need to pass at the end of their O-levels or their common entrance exams. So just a thought.
I could actually jump in at that point, because I think it's really important that we leverage the opportunities that they are present when it comes to civil society, because far too often we only run to civil society when all hell has broken loose. But we need civil society to be our touch point, our focal point, our first go-to persons, because they are the ones who are constantly on the ground, who have the experience, who know how to interact. And that leads me to my other point when it comes to the low-hanging fruit. I think one of the important things is that because we are so accustomed to the technical jargons and from a high-level standpoint, we tend to take for granted a lot of the times when we actually roll out programming that it's not connecting with our clients, our consumers. And so it's very important for us to make our work consumable. And what that means is ensuring that it's not simply about when you have these guides and stuff, you put some pictures and some colors and you highlight some points and stuff. That is not the answer. The information there has to really and truly be consumable, where even if you have a 10-year-old picking up this book, the information that is pertinent to him or to her should be able to be easily interpreted. And for far too long we've had, and I can tell you from my experience when I was growing up, in the newspaper, they used to have these frequently asked questions. So this little booklet, and you would see all these diagrams and read up on all this information. And truth be told, I was a bit traumatized. I looked at that and I started to question myself. If I had just a regular heat rash, do I have something? And you can imagine how traumatizing that would be for a young person. So we need to ensure that when we put information out there, it's consumable and it's not going to do more harm than good. In the absence of an adult or facilitator, can we truly ensure that this young person gets the information the right way? And if the answer to that is no, then we really need to revise that. And I also just lastly want to tie it into a question that was posed to me in preparation to this, in terms of how do you speak CSE or adolescent and youth sexual and reproductive health care with politicians. And it really is, at the end of the day, ensuring that whoever it is that you're presenting this to, you show, because the fact is that politicians are mainly concerned with getting re-elected. And how do you ensure that they see this as something that they can actually fulfill, and at the same time it serves their purpose? That is the sad reality of the situation. And I personally believe that, and we have the figures, we have the information, the cost-saving benefit of teaching comprehensive sexuality education to young people would be. Because you think about it in terms of young persons who are a burden on the healthcare system later on in life because they were not properly exposed to comprehensive sexuality education early enough. So they go on and engage in risky behavior. They, God forbid, contract something, and then they spend their life receiving treatment. And this is a burden in the minds of the person who prepares the budget. So you need to ensure that they understand that by you simply investing in young people at this age, you're going to be saving far more in the future. And an important quote that I came across, it's an African proverb which says, "A child neglected by his village will burn it down to feel its warmth." And I think that is something so telling of the times that we're in, because if we're not making the right investments in our young people at this time, what we can expect in the future is far worse than whatever it is that we're experiencing right now. So it's very important that we take the time to make the right strategic investments, because it will save us a lot of headache and heartache in the future.
Thank you so much for that. Policymakers are definitely policymakers are definitely obviously worried about getting reelected, and so to that end, my shameless plug is November 6th. Also, to your point about being like inundated with information that will definitely fear us, what we call that is WebMD. So I definitely understand turning a cough into planning my funeral. So thank you so much for that. We'll have one final comment from Ilya, and then we're going to wrap up with some final takeaway points from all of the panelists.
Yeah, it's about implementation. So as for me, I would not put it like this, that implementation is a problem. Yeah, it's not an easy and simple process, but it's not a problem. We see more and more countries who included sexuality education in their national policies. Look at Africa. So in East and Southern Africa, we have Easter Commitment. So it was in 2014. So all countries of East and Southern Africa, their prime ministers, they signed this commitment for on SRHR of adolescents and young people, including comprehensive sexuality education. They recommitted it 2 years ago in Durban during the AIDS conference. Western Central Africa, fingers crossed that next year we will have the same commitment in that region. And so countries, they are on different stages of implementation of sexuality education in Africa, but they have these programs. And, from our experience, from our advocacy with ministries of health and education in that countries, so we were trying to bring on the table that sexuality education is not only about sexuality or sex, as people see, or sexual behavior. It's about many, many problems which countries have in the field of health of adolescent and young people. Look, it's about early and child marriages. So we have 12 programs in 12 countries in Africa to prevent young and child marriages. So we know that 21% of young women in the age of 20-25, they were married by the age of 18, and 5% were married by the age of 15. 4% of boys were married by the age of 18. So, and we know, and we have evidence that it leads to the problems with their health. It's the high level of death because of the early pregnancies, etc., etc. It's about the problem of FGM, female genital mutilation. It's also comprehensive sexuality education can address these problems. Sexuality education can address HIV and STIs, so etc., etc. So at the end of the day, sexuality education is about youth citizenship, and this leads to country prosperity in future. So if we put it on the table with politicians, with governments, so they do understand that sexuality education, this is something that their national policies need to lead for the future, health future and prosperity for their own countries.
Thank you so much. Can we give the audience a round of applause, you too, but also the panelists a round of applause? This is as exciting as I hoped and as I expected, and I know we all learned a great deal of information. And so, to that end, if we could start with Senator Edwards providing 30 to 60 seconds, and I assure you I will cut you off, everyone. 30 to 60 seconds of a final takeaway point, what you really hope people can take action with when they leave here. And then we'll end with Lada.
Sure. Simply, I would say that sex and sexuality is not something to be feared. And we have spent so many years thinking that it's this taboo topic that it has crippled many of us from even advocating or going into spaces to speak about it. And it begins with us, simply. Us having an understanding that this is something that leads to population growth and development, ensuring that young people know that they too have a voice in these spaces and that their voices need to be heard. We need to ensure the professionalization of our sector, because for far too long, persons think that they can simply go out and advocate and, okay, yes, we'll make magic happen. But it all goes back into the professionalization of the youth sector even. You need to have groups that operate at a level where if they want to access funding from the UN or the EU or whatever space it is, that they have meet the criteria. So I just really want to put that out there. Professionalization of the youth sector is very important.
Thank you.
Ooh, pressure. So obviously implementation is not always ideal, but I think we need to remember that there's a lot of goodwill out there, that everyone is actually really pro-CSE. All the people who matter are very pro-CSE. Teachers, they want to teach CSE. They're not against it. They just don't know how. And students have said, basically 100% of students are really excited about CSE and want to learn more. Parents are also totally fine with CSE, unlike what we hear a lot of the time. So I think we need to leverage all these positive developments to try and improve implementation.
Yeah, I would like to make my final remarks by African proverb, which I heard from my boss, executive director from UNFPA. And for me, this African proverb is totally about the whole understanding of education and sexuality education in particular. So this African proverb says, if you close your eyes to facts, you will learn from accidents. So I think we should remember this proverb implementing comprehensive sexuality education.
So Sarah stole my line.
Sorry.
That there's more of us than there are of them. But I think the thing that I would also talk about is, looking at reforming perhaps the way we train teachers. And one of the things we know that's incredibly important in terms of sexuality education is to be able to teach it in a participatory way. And unfortunately, so many of the teachers that are trained in many countries are taught this very didactic, lecture-oriented methodologies. And I think it's difficult to say for teachers to go from where they've been trained in didactic methodologies to let's be participatory and talk about sex. So if there's ways that we can infuse these kind of participatory methodologies across a lot of teacher training, I think that will benefit the sexuality education.
Okay, as I'm from a low-income country and specifically from a village, it's important for me that all the global documents and all the global goodwill will come to local level, just because we always create these nice documents, nice headlines, nice events, but sometimes it doesn't reach out. The key populations in small countries, in small cities, and that is what important for me.
Thank you so much. Again, another round of applause. If there's anything I can impart upon you all that's something that you already heard offered by one of the panelists, then it's that it isn't about getting it perfect, it's about getting it better. And we hope that this conversation is just a start for how much we can get it better. Thank you all so much.